Good afternoon, everybody. Christine Barconi here in our NBC4i streaming center. We are getting ready for Governor DeWine's 2 p.m. press conference, but the new coronavirus numbers have been released by the Ohio Department of Health. Let's take a look at the numbers right here. A new 24-hour reported case change of 1,327 cases. That is the highest number we have seen in 21 days. Sorry about that. I had to mute myself. I was hearing myself double. Anyway, the highest number of cases we have seen in the past 24 hours in more than 21 days. There are 1,327 new cases. The deaths, there have been 13 reported deaths within the past 24 hours. That is below the 21-day average. So we are seeing a spike in cases there. We are waiting, like I said, for Governor DeWine's Thursday daily press briefing. Here is a live look outside the Ohio State House right now as we await for the governor to come out and give us an update. I'm sure he will address the spike that we are seeing here October 1st. Take a look at the numbers again while we are waiting for him. Hospitalizations are also above the 21-day average. Latest 24-hour reported hospitalizations is 90. The 21-day average is 69. A few days ago, we had a hospitalization number of over 100 at 106. And then over the past 24 hours, there have been 9 ICU admissions, again, above the daily average of, below the 21-day average of 11. But this is the number that we're looking at here right now. 1,327 new cases, about 300 above the daily average, the highest we have seen, as you can see here on this 21-day average chart, the highest we have seen in 21 days. 24-hour death change is below average at 22. So I'll leave you with a live look at the State House as we wait for Governor DeWine to come out and give his press briefing. Governor Mike DeWine is taking the podium now in his Cedarville home. We will listen in.
They were behind 1-0 last I saw. I hope it's better luck than the Indians to Iowa war. Indians lost a tough game last night, and the Reds lost a tough game on the noon game. So we'll see. I want to begin today talking for a moment about the presidential debate that occurred on Tuesday night. I want to congratulate the Cleveland Clinic, Case Western Reserve University, Mayor Jackson, the city of Cleveland, and the police department. They all did a great, great job. We're very, very proud of the job that they did. So Ohioans, we were certainly very proud to host this debate. However, the debate itself was certainly not our country's finest hour or not our country's finest 90 minutes. I hope that the next debate will focus on the future, on the vital issues, on the decisions that the next president of the United States will have to make, on the substantive issues that this country faces. This is a very important election. As you know, I support President Trump. His choices for federal district and circuit court judges have been exemplary. His choices for Supreme Court have as well been excellent. His most recent nomination of Judge Barrett is also excellent. I could not be happier with the nomination. I believe his tough stance in trade negotiations will continue in the future to expand job growth in Ohio and in this country. I've known Joe Biden for many years, having served in the United States Senate with him. While many times we may have disagreed on policy issues, I know that he too wants what is best for this country of ours. The name calling by both candidates is simply not helpful. The name calling by both candidates is not productive. Now, each of us saw this debate through our own eyes, our own lens, through the prism of our own beliefs and the candidate that we support. However, I do believe that there can be agreement on what we as Americans have a right to see in the next debate. What is needed in the next debate is a robust, energetic debate on the challenges that the next president will face. And as in presidential debates of the past, each candidate has an obligation to articulate a vision for the future of this country, to articulate what kind of a country that candidate believes we should be leaving to our children, our grandchildren, and our great-grandchildren. As I've done in the past at several of these press conferences, I want to talk about hate in America. And this is something that deeply concerns me. There are fringe groups and individuals in this country of both the right and the left who simply do not share our common values, who do not share the great values of this country. There are haters. There are people who hate Jews, Muslims, African Americans, and we could go on and on. There is no place in America, no place in this great country for that. There are also people, who believe that violence is the way to achieve political ends. That is not right. And I want to again speak out against that. White supremacists know only hate. Anti-Semites know only hate. And we could go on and on. It sickens me that there are people in our country who perpetrate this hate violence, and the work to divide us. We cannot let these fringe groups of the right or left divide us. We cannot let them into that system when they preach violence, when they preach hate. As I said at the end of May following the death of George Floyd, we have a responsibility to each other. We have a responsibility to our country. In all aspects of our lives, we simply must not allow hate to prevail over love, over kindness, over compassion, especially in these times of uncertainty, fear, division. Because, to paraphrase the words of Dr. Martin Luther King, hate is too great a burden for this country. I want to talk now again about the sanctity of the Ohio election process. We have a long, long history in this state of running fair, transparent elections. Because of laws passed by the General Assembly, work done by Republican and Democrat secretaries of state in the past and the current Secretary of State, Frank LaRose, and because of Democrats and Republicans working together at the county level and at the precinct level. They have worked together successfully for decades. And because of this history, and because of what we have done in the past and what we're going to continue to do, Ohioans can be assured of a fair, orderly election this November. As our history proves, our election process in Ohio is orderly. It is transparent. It's bipartisan. And as Ohioans can and should expect, the will of the people in November will be respected. In Ohio and in this country, elections are sacred. There is a sanctity to our election process. We give them proper respect. There's a reason. The flags outside the polling places are there not only to signal where that precinct is or where that voting place is, but they also say to the approaching voter, this is truly a special place. Inside these flags, you and your vote are safe. Campaigning ceases inside this space so that voting can go on unfettered, so that people can feel safe and confident and heard. My commitment to every Ohio voter is this: we will not tolerate any interference in this sacred process. We will, as we have done in the past, protect each citizen's right to vote and to have their vote counted. The system, this bipartisan system, has worked in the past. It will work again. Talked to Frank LaRose today. He wanted me to remind you of several things. The last day to register to vote is this coming Monday. If you are not registered, you can do it at your Board of Elections, or you can register online at voteohio.gov. If you are not registered, or if you aren't sure about it, go ahead and contact the Board of Elections. You can go online. Further, for over a decade now, Ohioans have enjoyed a menu of options for casting their ballot. If you'd like to vote on Election Day, November 3rd, that option is protected and open to you. The polls will be open from 6:30 a.m. to 7:30 p.m. at night. You can find your polling place at voteohio.gov. If you want to vote in person, but worry you won't have time on Election Day, your County Board of Elections will begin opening their early Vote Center this coming Tuesday, October 6th. You can see the hours and locations also at voteohio.gov. If you prefer to cast your ballot in the privacy of your own home, Secretary LaRose has mailed an absentee ballot request form to all registered voters. Fill it out, mail it in today. If you misplaced that application or accidentally threw it away, you can download a new form again at voteohio.gov. Finally, I want to address what happens after the election. One of the things we've done well throughout our history is the transfer of power after an election. Sometimes the incumbent president is reelected. Sometimes it might be an open seat. Sometimes it's a situation where the incumbent loses. But whatever the situation, since the beginning of this country, however hotly contested these races have been, however riled up people get, however partisan it gets, however emotional people get, when the results are in, when they are in, people will accept it. Might not like it, but we're Americans. We accept it. As an author, Theodore White wrote in a book about another presidential election a number of years ago, we as Americans understand the transfer of power. We get it. We do it right. Talking about Election Day and ultimately this transfer of power, if you just bear with me for a moment, I'm going to quote what White wrote. He's talking about the campaign and campaign ending. All of this is and talking about Election Day. All of this is invisible, for it is the essence of the act that as it happens, it is a mystery in which millions of people each fit one fragment of a total secret together, none of them knowing the shape of the whole. What results from the fitting together of these secrets is, of course, the most awesome transfer of power in the world. The power to marshal and mobilize, the power to send men to kill or be killed, the power to tax and destroy, the power to create and the responsibility to do so, the power to guide and the responsibility to heal, all committed into the hands of one individual. Heroes and philosophers, brave men and vile, have since Rome and Athens tried to make this particular manner of transfer of power work effectively. No people has succeeded at it better or over a longer period of time than the Americans. As the transfer of this power takes place, there's nothing to be seen except an occasional line outside church or school, or a file of people fidgeting in the rain, waiting to enter the booths. No bands play on Election Day, no troops march, no guns are ready, no conspirators gather in secret headquarters. The noise and the blare, the bands and the screaming, the pageantry, the oratory of the long fall campaign fade on Election Day. All the planning is over, all effort spent. Now the candidates simply must wait. That's what we do. We are Americans. We do it very, very well. And we will do it this year as well. Let me go now to Lieutenant Governor for a few comments.
Thank you, Governor. I'm going to start today by talking about workforce issues, jobs, and what we consider the foundation of a prosperous economy. We're going to talk about tech cred starting off. The August round was record-setting with more than 1,227 credentials, more than the June round. For reference, we had 3,241 credentials in June. We had 4,468 credentials awarded in August. Today, we are announcing that 288 Ohio companies have been approved for more than $3.4 million in this round to earn those 4,468 credentials. These are, remember, industry recognized tech credentials. And after 5 rounds of funding, we now have 983 Ohio employers that have been approved for 11,941 tech-focused credentials. I make this announcement with a bit of satisfaction because, as you recall, Governor, we promised that we were going to try to do at least 10,000 of these in the first year, and we're exceeding that mark with nearly 12,000. And we believe that these micro degrees, these tech credentials, these industry credentials are the foundation of a growing, vibrant economy. More and more employers are turning to these industry recognized credentials as evidence that you can do the job. And in this case, they are upskilling their existing workforce, helping those individuals not only contribute to the success of the company, but also to their own success by helping them potentially earn more, helping them become more job secure. We are announcing today our next round, which opens up today, October 1st. Hard to believe it's October 1st already. And that will close on October the 30th. Anybody who's interested in more information, go to techcred.ohio.gov to find out how you as an employer can get funding to upskill your workforce and how individuals can get these tech-based credentials. Now I'm going to turn to Dr. Abby Norris Turner from The Ohio State University. As many of you know, we worked with the Ohio Department of Health to perform an antibody study, or Abby did, and her team to learn more about the rate of the virus spreading and to create a benchmark for positive results so we can know more accurately how to track the spread in coming months. Really, we're trying to find out maybe how many people have had the virus, how many people have the virus, what we can learn for that. It's great that Dr. Abby Norris Turner is able to join us today to talk. Dr. Norris Turner is an infectious disease epidemiologist. She has decades of experience in this area and has shifted her focus this year to understanding the epidemiology of COVID-19 in our state. She has been a great resource to the governor and me and our entire team throughout. And I want to thank Dr. Norris Turner for joining us. And if you could, Doctor, please let us know how the study was conducted and what you found.
Yes, I'm happy to do that. And it's really a pleasure to be able to be with you here today. So I want to start out, of course, by also thanking the colleagues who helped to make this work happen. So both folks I worked with at Ohio State, but also an incredible group at the Ohio Department of Health. Also our partners with our partnerships with local health departments and local health districts who let us work out of their buildings during 20 hot days in July, and more than 100 study staff members who helped us to collect data and supported the teams in the field with logistics and other tasks. And most importantly, the participants. So folks across the state of Ohio who agreed to join this project and help us answer this question. So to jump right into it, the purpose of this project that we carried out was to create or to calculate 2 specific estimates. The first was the estimate of active COVID-19. So how many people have COVID-19 at that moment in time? And the second was to estimate the prevalence of people who had had COVID-19 in the past. And the way that we did that was to select 240 census tracts that are geographically representative across the state. And then within those 240 census tracts, we randomly sampled households. Once we had that list of households, we sent folks first a postcard and then a letter which explained what would happen with the research study and also gave them instructions for how they could opt out of participation if they knew ahead of time they didn't want to join the study. From people that we did not hear from ahead of time, we visited them at their home and we explained the study in person if someone was home. And if someone was not home, we left information about the study at the home and asked them to call us, in which case we would or text us or email us, in which case we'd come back. For people who are interested in proceeding, we went through the process of informed consent, so they understood what was involved with the project. And those who consented then went on to give biological samples, which is what we then tested to be able to come up with our estimates of infection. So a trained nurse from the Ohio Department of Health first collected a blood sample, which we tested for antibodies against COVID-19, and then a nasopharyngeal swab sample, which is what we tested to look for active disease. And these results at the end of the study are combined statistically. So the households going into the census tract and the census tract representing the state to come up with these estimates that would be a statewide estimate of prevalence. So over these 20 days in July, from July 9th to July 28th, 727 Ohio adults participated in the research. And once the laboratory assays were done, we combined those findings using a Bayesian statistical approach to generate these estimates. And so for active disease, we found that 0.9% of the sample, so that's just under 1% of the sample, had active COVID-19 during that time. And the confidence interval around that 0.9% goes from 0.1% to 2.0%. And following a similar process looking at the antibody findings, we found that 1.5% of people in the study had evidence of antibodies to COVID-19. And the confidence interval around that goes from 0.3 to 2.9%. And just a note of a sort of reminder to folks thinking about those antibody results, we now understand that the assays that are conventionally used to measure antibodies to COVID-19, they only provide a look back window of about 3 months. So that those antibody numbers don't tell us who's been infected since the beginning of the pandemic in Ohio. For a study done in July, it's really only a maximum look back to about the middle of April. We don't have a lot of data to compare our findings to, but what we do have suggests that what we found is right along with expectations. So those numbers are similar, for example, to what the Ohio Red Cross is reporting among antibody prevalence among blood donors. And just this week, CDC released findings from a large seroprevalence study that they're doing across the whole country, including in Ohio. And our results are also similar to what they found.
Well, great. I know that that a lot of people have been, awaiting this to find out, because somebody always wants to ask the question, how many people in Ohio have had the virus? I know that this study, can't definitively tell us this. What if you look out and try to do your best to extrapolate out, how many people can we estimate in Ohio may have had the virus already or currently do?
Yeah, such an important question, and of course critical for understanding kind of what's coming next, right? We always want to look back at what's happened so far. One of the important answers to this question is that these data from this study can't give us a precise number. What we can say more generally and with confidence is that the prevalence of COVID-19 among adults in Ohio, this study only tested in adults, but the prevalence in adults in Ohio is relatively low, has remained relatively low. The flip side of that coin, of course, is that means many more people are still susceptible to infection. So just to convert some of our prevalence numbers estimates into real numbers, I told you that 0.9% of the sample had active disease during this period of July. And if you look at the population of Ohio adults, that corresponds to about 80,000 Ohio adults who would have had COVID during these 20 days in July. Similarly, if you look for that at that 1.5% antibody prevalence, that corresponds to about 133,000 Ohio adults who had evidence of past infection. But we can't really extend those numbers to other time periods because whether people were exposed depends on the prevalence at other time periods and basically what was the circulation of the virus in their communities at those other time periods. So it's hard to take what we learned from July and make a broader argument than just that period of time. Again, though, even in place of exact estimates, what we can say with confidence is that some hundreds of thousands of Ohioans have had COVID and millions of Ohioans remain susceptible to COVID. So the same public health efforts which have worked to keep the prevalence of disease low are still needed to prevent ongoing and forward transmission.
Another question I know that I always get a lot of people who are curious, because the antibodies stay in our system somewhere. I think I heard you say, maybe you didn't say it in this, but on another time, about 50% of them, 50% of the sample keeps antibodies for 2 months. Some of the other 50% maybe for 3 months, but very few people carry antibodies beyond 3 months that are detectable. But that doesn't mean that after 3 months that they still don't have some type of immunity that we would expect. So to give us a feel for what that means in terms of antibodies and immunity to the virus once you've had it.
Yes, I'm happy to tell you what's the state of the science at this moment with immunity, and with the huge caution that this, like so many things with COVID, this is changing all of the time as we have new information from around the world, really. So what you said is true, which is most people will no longer have detectable antibodies, at least from what is measured in these conventional assays, for longer than 3 months. And what that means after that 3-month period for their immunity is really still an open question. It may be that there are other elements of their immune system that are still active, but we're not measuring that. And so we don't know if that's providing some kind of protection. Similarly, what we tend to do is measure the level of antibodies in people's blood, but maybe what we should be measuring instead is the activity of those antibodies. How good is that person's antibodies at neutralizing the virus when exposed, for example? And maybe that's more meaningful for understanding their immunity. So to answer your specific question, maybe there's some short-term protection, and epidemiologically, we don't see a lot of reinfection occurring in that 3-month window. So maybe there's some short-term protection against reinfection. We are starting to see reinfections in the scientific literature now, although they tend to happen a little bit longer after the initial infection. And what's really unclear right now is whether those are going to be general trends that the population at large will be susceptible longer or after some time, or whether there's something special about those people. Maybe they didn't mount a full immune response at the time, and so they remain susceptible. So I guess the conclusion to this is that COVID-19 continues to surprise us, and so we shouldn't make any optimistic or pessimistic predictions about short or long-term immunity to disease. But those surprises keep giving us opportunities to work with stakeholders really across the state and around the world to answer those questions.
Great. Well, thanks for doing the study for us and for joining us today. I know that more information about the study will be available on our coronavirus website under the dashboard overview. We really appreciate what you did to help us have a little better perspective on this. I guess probably one more question. Ohio fits in compared to how and some of the studies have gone on in the other states. Are we pretty comparable?
In the very local region of the Midwest where we are among the lowest. So I believe West Virginia, and at the time that the study was done, Wisconsin were slightly lower than Ohio. We're quite similar to Indiana, and we're lower, of course, than Pennsylvania, and much lower than New York. So yeah.
Well, great. We appreciate your time. Thank you very much.
Thank you so much.
A couple of final issues. We like to highlight businesses who are stepping up to try to help us work through the virus response and to help the citizens of the state of Ohio learn to live with the virus in their lives and get through it as well as we can. Today, I want to highlight an announcement that's being made by the Foundation for Appalachian Ohio. Governor and I often talk about the need for internet connectivity for our students, for healthcare, for the economy. And today the Foundation's I'm a Child of Appalachia Fund has partnered with Facebook and T-Mobile to provide hotspots to libraries in Southeast Ohio that will be made available to be checked out like other library resources. Facebook is providing these mobile hotspots at no cost to the libraries along with 6 months of unlimited data usage on the T-Mobile network. And then T-Mobile is kicking in an additional 6 months, so these hotspots will be available for a full year of unlimited data for use by library patrons, as well as helping those hotspots already in use. The Foundation for Appalachia, Ohio, Appalachian Ohio is one of the many organizations to help us fill this important role. If you'd like to find out more about the effort, you can go to appalachianohio.org. This initiative is very complementary to something the governor and I announced, where we put $50 million of CARES Act funding, made that available for schools. This will help communities and families as well. This pilot will be, or this program will be available at a minimum in Athens, Harrison, Highland, Jackson, Lawrence, Meigs, Pike, Vinton, in Vinton counties. And there's an endeavor to get out a total of 240 hotspots to the libraries in these communities to help extend broadband high-speed internet, I should say high-speed internet service to the people in these communities. So thanks to the foundation and Facebook and T-Mobile for stepping up to help people in this time of need. And then finally, a quick update. Last year, I went to London to work with Jobs Ohio on the London Stock Exchange Group, moving its America's headquarters to Cleveland. Due to COVID, that has been postponed, the physical location of the headquarters until 2021, but that doesn't mean that the virtual efforts are not underway. They absolutely are, and I'm glad to announce today the financial support, thanks to the financial support of the Greater Cleveland Partnership, Fifth Third Bank, and Jobs Ohio, that over 10 companies will be beginning to participate in the Elites International Private Company Development Platform. The Cleveland cohort will start on October the 12th. Why is this important? Because the companies that participate in this historically have experienced 7 times the growth, created 4 times more jobs than their industry peers. We want to jumpstart these activities, these businesses in Ohio, to take them from small businesses to medium-sized businesses, maybe someday even a larger business, by helping them understand how they can grow and connect to the rest of the world. And so we appreciate that the Global Elite Program and the partnership, the Cleveland Growth Partnership, and Fifth Third Bank, along with Jobs Ohio, are helping to promote this and get this started. And Governor, if just one thing I'd like to say in support of your earlier comments, thank you for what you said about America and our democracy and our elections. Our elections in Ohio are tried, true, and tested. And I want to remind folks, I had the privilege of serving Ohio as Ohio's Secretary of State for 8 years and as its chief elections official. And remember, elections in Ohio are run by your neighbors. The 88 county boards of elections, they are made up of Democrats and Republicans that live in your community. The local polling locations are operated by men and women who are your friends and neighbors. And if you have concerns, if you have questions about whether the elections process is going to run well, be part of it. You can be a poll worker. The elections, the people who run elections in Ohio are the people of Ohio. You can be one of them. So go to voteohio.gov and sign up to be a poll worker, because our election system in Ohio is a great one, because it's run by the people of our state. It's something that you can count on. Please participate as a poll worker. It will give you insights and probably help you build confidence in the system we have in our state. Governor, thank you very much, and back to you.
Lieutenant Governor, thank you very much. We're going to try to get as much time for questions today, but I do want to go through this pretty quickly. This is Thursday, so this is the day we put new data out. So let's go to our daily slide, which is up here. What you will see here, we were tracking down, and for a while we had an average below 1,000 cases a day. Now we're above that. And as you can see, for yesterday, the most recent data, it's 1,327 cases. So starting to go back up, it looks like, in regard to that. I'd also mention the positivity number, which we talk a lot about. And you'll see that in a minute in some other states where we're advising you to be careful if you go there. Our positivity for the last month or so has been coming down. And it got a little bit below 3%. In fact, I think it was down at one point to 2.6. We're now starting to see it go back up. And so we don't know whether that's a long-term trend. Our most recent day was 4%. We're averaging a little bit over 3%. So we're watching that. We don't know whether that's a long-term trend or not. We certainly hope it is not, but we're seeing the cases go up and we're starting to see the positivity inch back up, and we hope it's not a long trend. Eric, let's look at the case hospitalization and death table. We won't go through this. This is posted. You can take a look at it, but if you want to look at your county, what you can do is you can look and see the number of cases. We have this in September. So as September ends, you can look back and see cases, how many cases your county had, new cases your county had in the month of September. How many people went to the hospital, were hospitalized during that period of time. And then you also see the number of deaths that are reported during that period of time. These are lagging indicators, and they lag behind. And as I've said before, the deaths are reported when we get them, not necessarily when that death actually occurred. Eric, let's go to the travel advisory map. These are these are the states. We'll see how good everybody's map judgment is here. But these are the states that have over 15% 7-day moving average. Highlighted states are ones that are currently reporting a positivity of 15% or more. So again, you're traveling to those states, obviously, and coming back, be careful. If you're traveling there, staying for a while, be careful as well. Let's look now at our next slide. Eric, this is top 20 counties ranked by highest occurrence. Again, there's really two different ways we're looking at this. One is the color code, 7 different indicators. Some of these are leading indicators, kind of showing you the trends where things are going. Then there's this, and this is something we started a month or so ago to show you which counties have the highest number of cases per 100,000 population, so we can compare apples to apples over the last 2 weeks. So that would normally is a 2-week rank, and that's what you're seeing. That's what you're seeing here. And again, you can take a look at those online. Let's move now to our color code maps, Eric, and see what our changes we might have here. This is our alert map. Again, we use the term alert because it kind of gives people an indication of some of the early indicators as well as what's going on now. We're seeing more red counties this week. Again, that's not good. We have 11 red counties, more than we've seen at any point in September. Although many Ohioans are certainly working hard to keep this virus in check, unfortunately, we're seeing a rebound in some areas of the state. Southwest Ohio, we're seeing a couple more counties go back to red. We saw an increase in cases among college students in late August and September. Thankfully, these cases were mostly in young and healthy people. Our concern, of course, always is that they spread that to others. And we don't know, frankly, if the uptick that we're seeing in these counties is due to spread from these college students or not. We really, our data team cannot tell that at this point. Our colleges are doing a good job. They're fighting back. They've worked hard to keep these cases under control. Let me talk about the 4 new red counties. 4 new red counties are Claremont, Hamilton, Muskingum, and Richland. And let me just go through quickly a few of all of the counties. Mercer County continues as red this week. They met the CDC's threshold for high incidence. Mercer County's cases per capita have increased from 206 on September 8th to 260 this week. It's a 20% increase. Local health department officials said they had 24 new cases in the 24 hours between Tuesday and Wednesday. In addition to sustained community spread, the county has had 2 small long-term care facility outbreaks, and officials are also seeing scattered cases within the school district. Putnam County continues red this week. The county meets the CDC's threshold for high incidence. Local health department officials attribute the continued community spread to transmission within families and between groups of friends and families getting together. They also said they're having concerns with people following appropriate quarantine and isolation instructions. Pike County, they continue red this week. The county meets the CDC's threshold for high incidence, and during the past 2 weeks, the county has had 47 cases. That represents about a fourth of their total cases since the beginning of the pandemic. The county has had at least 22 cases linked to a large event. The event was in a neighboring county, but Pike County residents attended. The county also has spread from family and friends just getting together, household transmissions, and community spread. Butler County continues as red this week. The county meets the CDC's threshold for high incidence. Butler County's health department said Miami University cases have stayed steady at about 20 to 25 new cases per day. Schools have been doing very well, although there have been some K through 12 been doing very well. There's been some spread associated with sports teams. Many of the county schools will be transitioning to in-person in October. Residents continue to have large gatherings, which is causing a lot of this problem. No mask wearing and no social distancing is what our local officials tell us in Butler County. Let's move to Muskingum. They return, unfortunately, to red this week. The county was last red on August 13th, only stayed red for that week. The county has had 105 cases during the past 2 weeks, which is a fifth of their total cases during the pandemic. Local health department officials reported this week that they have 42 cases linked to an outbreak that spans across the Eagles, the Moose Lodges, the VFW, and the American Legion. There have been 9 hospitalizations, with 2 people in the ICU and 1 death associated with the outbreak. Local health department officials asked the clubs to close to slow the spread, and all 4 complied. As of this morning, the county had 90 active cases and 333 people in active quarantine. Hospitalizations have also increased. Montgomery County has been red now for more than a month. The county meets the CDC's threshold for high incidence. University of Dayton is reporting fewer cases. The school dashboard reported 25 cases on Tuesday and 9 cases on Wednesday. The school transitioned to remote learning for 2 weeks and returned to in-person classes on September 24th. Montgomery County officials are also reporting some cases in school districts, and the county also has a large nursing home outbreak. Let's move to Scioto County. Scioto County continues as red this week. There has been a sustained increase in new cases, growing from an average of 4.5 cases per day average from September 18th to almost 8 average cases per day on September 25th. Outpatient visits for COVID-like illnesses are also increasing from an average of 13 visits per day on September 19 to 21 average visits per day on September 26. Local health department officials report cases associated with sports teams, social gatherings, and community spread. Hamilton County. Unfortunately, Hamilton County returns red this week. The last time the county was red was July 30th. During the past 2 weeks, the county has had 737 new cases, an average of about 50 new cases per day, and close to where the county has been most recently. According to local university dashboards, cases at the universities total about 200 during the past 2 weeks. However, it's important to note that the university cases are on the decline. Good news, and there is a shift towards a greater percentage of cases in older adults. The county has also a recent sustained increase in outpatient visits. Let's turn to Richland County. They meet 6 of 7 indicators this week, and they are on our watch list. The county has more than doubled their increase in new cases, growing from 4 average new cases per day on September 19th to 9 average new cases per day on September 25th. county added 95 new cases during the past 2 weeks. These case numbers exclude incarcerated individuals. So we're not counting that. The county also has sustained increases in healthcare utilization, including outpatient and emergency department visits and hospital admissions. Local health department officials report community spread and outbreaks at correctional centers and a long-term care facility. They also report that families continue to plan events, and that is part of big events, and that's part of the problem that they're seeing. Ashland County. Ashland County continues red this week. The county meets 4 indicators and is seeing a sustained increase in new cases. Local health department officials report that there is a large outbreak in a long-term care facility and an outbreak at Ashland University. There are also outbreaks associated in an event center where a wedding was held, a workplace, and social gatherings. The health department officials report they are seeing more community spread of the virus, and unfortunately, there is resistance to mask wearing and social distancing in the county. Let's go back to Southwest Ohio. Claremont County returns red this week. The county was last red on August 20th. The county has added 129 new cases during the past 14 days. The county is seeing an increase in healthcare utilization, including an outpatient and emergency department visits. Local health department officials in Claremont County reporting outbreaks at a long-term care facility and a small workplace outbreak. Although the county did have some cases associated with sports teams, overall, schools are doing well with compliance and case management. Schools also have been cautious about sponsoring events, and many have canceled or changed their homecoming plans. However, the health department told us they have concern about parents that are holding alternative events. Let me talk for a moment about a couple of stories we've heard this week from local health officials. Again, we tell these just as a warning, really. First example involves a couple. The husband, who was in his 80s, passed away of a non-COVID related cause. His funeral was in a neighboring state. His 85-year-old widow attended. The funeral director in the neighboring state did not wear a mask and passed COVID to the widow, who subsequently became ill and died. Another example, a man was in ICU for a non-COVID related reason. The hospital tested him initially and he was negative. His wife continued to come visit him but refused to wear a mask despite the best efforts of hospital staff to encourage her to do so. She started feeling ill after a few days and tested positive. Now her husband also is COVID positive. These are just several examples. Again, just sad cases. We only share them just to show how easily that this can be transmitted. I am going to stop. We were going to hear from Alicia Nelson, who's our Recovery Ohio director. She will join us next week because we're out of time. But she will talk about the problem of drugs and how we are trying to deal with that. We've talked about that in the past, but we continue to see the drug problem. One of the sad outcomes or sad things we're seeing from COVID is we've seen an increase in drug use in Ohio. We'll now go for our questions.
Governor, your first question today is from Scott Hallis at the Xenia Daily Gazette.
Hey, Scott.
Hey, Governor, how are you?
Good.
Good. This may be the worst time to ask this question given what you said about some of the cases being on the rise and the positivity coming up, but we've got high school playoffs starting up. They just announced the football brackets today. They're actually being loaded as we speak. Is there any talk of maybe increasing the amount of fans that are going to be allowed, especially as we get deeper in the tournament and they tend to use bigger stadiums?
Well, our goals, Scott, remain the same, and that is that parents have the opportunity to go see their kids play, family members. So if anything is done, and we're open to talk to the school officials, we granted, for example, the local health departments and the state dozens of variances throughout this year in regard to their schools in order to allow parents to attend. And that's our goal. So as we look at playoffs, that will remain our goal. And, as we look at, every sport's different. Cross country is a lot different than football. We're open to try to accommodate so that the athletes can run, play football, whatever the sport is, And at the same time, the parents can come and see them play. Their loved ones can see them play. So that will be our kind of our North Star as we look at that.
Next question is from John London at WLWT in Cincinnati.
Hey, John.
Hi, Governor. Hamilton County and Claremont County going red, and Butler County staying red. You know, that's a big section of Southwest Ohio, and I'm wondering what you envision for the early fall now going into Thanksgiving, and what actions you might consider should the numbers go higher for schools, sports, and daily activity.
Well, John, it's a good question. We monitor this every single day. We're on the phone with local health departments frequently. We're talking to school superintendents. I get emails from different superintendents. You know, in regard to our schools, I think our schools are doing a very good job. They're on this. They're doing the best job that they can. What we're seeing is, you know, our concern was that when we saw outbreak with kids, that would lead to outbreak with older Ohioans. We're seeing that. What we don't know is if there's a cause and effect. We're seeing more from older Ohioans. You know, for a month or so, it's been, you know, a big percentage is under the age of 30. Now we're seeing these numbers go back up with an older population. And so the simplest thing to do is to be able to curtail these events. I mean, I read examples. If we could get 80%, 85% of the people in this state in every county to wear a mask when they're out in public and to avoid these big events, we'd have this thing under control. I mean, it'd still be here, but we would have it under control. And so I know everybody's tired. I'm sick of it. You're sick of it. We're all sick of it. But we got to hang in here. You know, I get the question a lot. Mike, when's this over? When can I take my mask off? When can I go about life as normal? And I don't have a great answer, but the best answer I can come up with is when that will happen when we get herd immunity. And as you heard from the discussion that John Husted had in the study that he presented today, we're not going to get that without the vaccine. I mean, we're not going to work our way into this for years. So what we have to do is hang in there. We got to keep this virus low. We got to keep our foot on its neck, and wait. And we wait for the vaccine to hit. And when it gets here and the first people start getting the shots, we got to encourage everybody to get one that can. And it's going to come layered. It's going to start with our most vulnerable people in our nursing homes and others. It's going to start with our first responders, and it's going to take a while to get this out. But the point that we get this way out, so we've got a significant segment of the population, and I don't know what that segment is, but a significant segment, you know, that have that immunity. If this does in fact work the way we hope it will, then that's when we see the end of this. I mean, look, we're tough. We're Ohioans. We've been at this 7 months or so. And it's not easy, but we just got to keep going, or we're going to have these outbreaks. And when we hit the outbreaks, I know this has been tough on business. I know it's been tough on bars. I know it's been tough on restaurants. I know it's been tough on a lot of small businesses. And I know it's been tough on people losing their jobs. And if we're going to have any chance of continuing to grow the economy, then we got to keep our foot on this devil down there. And it can only be by people wearing masks. So the things to do, John, differently, there aren't different things to do. We just got to do what we know we got to do. And if we get those numbers back, I mean, I was on the phone this week with a number of health directors who said, look, our mask compliance was going up. It was great. Now it's starting to go down again. And I get it. People are wore out, but we're Ohioans. We can't get wore out. We got to hang in there. And by hanging in there and doing the things that we need to do, our kids can play sports. Our kids can go to school. We can keep our businesses open. But it's only if we do these other things like wearing the mask and keep a distance. That's where we are.
Next question is from Laura Hancock at cleveland.com.
Hi, Laura.
We'll come back to Laura. Next question is from Alex Ebert at Bloomberg.
Good afternoon, Governor. Thanks for your time.
Yeah.
Larry Albaugh is expected to introduce a bill called a trigger ban, which would eliminate the right to have an abortion in Ohio if Roe v. Wade is overturned by the Supreme Court. Do you support a trigger ban for the state of Ohio?
I have not looked at it. It's literally the first thing I have heard about it. As I think as you could tell by my comments about President Trump's appointments to the court, like strict constructionist, people believe in the Constitution, and I think everybody knows I'm pro-life. But I've not looked at this. Literally, this is the first I've heard of this. Don't know what it does. So.
We'll go back to Laura Hancock at cleveland.com.
Good afternoon, Governor. The legislature has not acted to repeal House Bill 6 yet. Attorney General Dave Yost has called on the utilities to prove they need the money. Ohioans are going to start paying these fees and our utility bills soon. As governor, do you have any duty to them to make sure that House Bill 6 doesn't come to fruition?
Well, I think the Attorney General is right that we need to know this. One of the issues that has been debated and kicked around is whether or not, the legislature, when it passed the original bill, had enough information about what the need was to keep the nuclear plant open. And so I'm always for transparency, and I've not talked to the Attorney General about this. We'll talk about the process of who should do it. But I think from what I read in the paper at least, I think he's right that transparency is always good, and more information about, what their actual financial situation is would be helpful. And this is, again, I would like to see the repeal, as I've said, this needs to be repealed because the process was so flawed that it has cast a light on this bill that it can never recover from. I mean, we've got to repeal it and figure out where we're going from there. But that's been my position and remains my position.
Next question is from Jim Province at the Toledo Blade.
Hey, Jim.
Hello, Governor. I think this question is probably for the Lieutenant Governor or for Abby. Now that we have this information from the prevalence study, is there some practice we put that to? I'm curious as to whether there is something or a decision we can make.
Jim, we're losing you, unfortunately. At least I am. I don't know whether the Lieutenant Governor can hear you or not, but.
Yeah, I couldn't hear the question.
Yeah. Jim, can you try it again?
I think we've lost Jim. We'll bring him back up when he reconnects. Okay. Next question is from Marty Schladen at the Ohio Capitol Journal.
Good afternoon, Governor.
Afternoon, Marty.
Last week, when I asked you about the president's refusal to say that he would promise to abide by the outcome of the election, you responded by saying you didn't know what was in his heart. But of course, I wasn't asking about what was in his heart. I was asking about what he said and what he's not said. And again, before tens of millions of people during the debate, he refused to say that he would abide by the results of an election in which he's behind in the polls. And I want to be clear about what's at stake here. Hundreds of Americans have died on hundreds of battlefields protecting the principle that in a democracy, leaders yield power to the will of the voters. So respectfully, I'd like to ask you again, do you condemn Trump's refusal to say he'll respect the will of the voters?
Marty, I think I addressed this, in my opening statement. Whoever loses, once it's determined that they've lost, they lose. And, we can go back to the most hard-fought campaigns in anyone's memory. And as I said the other day, my dog is jumping up here. As we said the other day, first election I really remember is Nixon and Kennedy, and people won Nixon, won Nixon to contest it. Hey, they stole the election from you in Chicago. They did this and that. And, he said, no, I'm not going to do it. I'm not going to do it. The Gore Bush, nothing could be more hotly contested. Went all the way to the Supreme Court, went into December. But when it was finally clear, the court had ruled that was it, losing candidate, Vice President Gore, conceded. So whoever loses will concede. This is what we do as Americans. So, this is what we do. And this is what we expect. And that's the name of the game. When you get in the game, you know that you may lose someday. You may lose in a presidential election or a U.S. Senate race or state legislature, and you lose, you lose. That's it. So look, anything to the contrary is just not right. I mean, no. This is what is great about this country. We have carried this out, as Theodore White, the excerpt I read, says, we've done it longer than anybody else has. And we've done it successfully, and we do it every 4 years. And I'll tell you, we're going to do it this year.
Jim Province from the Toledo Blade is back. Jim, please ask your question.
Hi, can you hear me now?
You're good. You sound good. Yep.
Great. I was just trying to get at the practical aspect of the prevalence study. Is there something that we can do today, today that we were not able to make before we had this information?
John, can you hear that?
Yeah, I did. Look, we wanted to have information about active cases and get estimates about how many people have potentially had the virus. And, when we had the conversation with the doctor, she indicated that, it's hard to make a hard and firm estimate. I, in looking at the math and having conversations with people who've looked at the data, believe that one could conclude that hundreds of thousands of people have had the virus, that you'd look at that information and reasonably conclude that 500,000 to 600,000 people maybe have had the virus. Again, not hard and fast. This information will be out there. Other people will be able to look at it and come to their own conclusions. But I think the big thing that we know is that, look, the goal ultimately is to get to herd immunity, and that we're going to need a vaccine to do that. If there's one takeaway that I had from that information, is that we've got a long way to go, that we've got to get a vaccine, and that the combination of the two are the way that we get there. And I don't know if Dr. Norris Turner is on, if she wants to offer any conclusions to that beyond what I've said. I think maybe we could have her join.
Yes, I'm still here and I can jump in quickly, which is to say that most of the testing and prevalence information that we have in Ohio, but also across the country, comes from people seeking testing because they're unwell or they've had a documented exposure. So this was the first study that really tried to get an estimate much more broadly around the number of people who had either had infection in that period in July or who'd been exposed, without depending on their access to testing or their desire to be tested, or a requirement for them to be tested. So when that has been done in other settings, sometimes what happens is that you learn that a lot more people had infection in the past than had been reflected through other data streams. And so what this study did was to confirm that, in fact, the data that we are getting through other data streams, other surveillance efforts, other projects of the Ohio Department of Health and others, do give us a good sense of how many people have been exposed and how many people have been sick. There wasn't a huge number of people, and in some other studies, particularly in New York in the beginning of the epidemic, some of the early seroprevalence studies suddenly suggested that lots more people had been sick than had been known about. And that's not been the case in Ohio. There are more cases from our study. There are more cases in the state than are picked up in testing. That's not a surprise. That's a very standard finding across the country. But it's not a huge difference. It's not an enormous disparity. And so we should keep on doing what we've been doing in terms of embracing public health efforts. Those things are working, and the prevalence is staying low because of them.
Next question is from Jim Oddie at WHIO in Dayton.
Governor, I have a question going back to your original statement at the very beginning of all this, and that is about the debate the other night. I know you've been part of a lot of debates. I don't remember you yelling over the top of your opponent or them yelling over the top of what you're trying to say. Would you support the Commission on Presidential Debates going to a mute button that would be controlled by the moderator so they could cut somebody off as soon as they start violating the rules and trying to shout down their opponent?
Well, they've already said they're going to look at this. There's certainly been speculation that they might do that. I think they'll do whatever they think is necessary to, have us focused more on substance. I wouldn't have any objection to it. I'm not a candidate, but I wouldn't have any objection to it. I will say, Jim, as you've watched some of the debates I've been in, and frankly, sometimes, in the battle you get overheated. But that does in fact happen. But the White House is at stake. The leader of this country will be selected. It's important that the American people be able to see the exchange of ideas because there are differences, fundamental differences between these two candidates. Both love America, both love our country, but there's fundamental differences. And I would hope that the next debates, actually there's a VP of debate, and then there's 2 more presidential, I believe, that they would focus on those differences. I think it's legitimate for someone to say what they've done. I think it's legitimate for someone to criticize someone for what they've done or not done. I think those are all things in bounds. This is a robust, as I described it a moment ago, a robust discussion, debate, hard fought is what the American people expect. But I think they expect it over the issues and be able to sit back and watch this for 90 minutes or however long it lasts. The debates of historically, we went for many years without these formal debates. But beginning in 1960, we had one, and then I think it picked up again, and I don't know whether it's 68 or 72, but at some point picked up again. Then now it's something we do every 4 years. So anything that will enhance that debate, I'm for.
Next question is from Andy Chow at Ohio Public Radio and Television.
Hi, Governor.
Hey, Andy.
Governor, at the beginning of this, you spoke about denouncing white supremacy, the sanctity of the elections. You just answered Marty's question about you feel pretty confident about a peaceful transition of power, but how can the citizens of Ohio feel confident about all those things when President Trump undermines those things? And you refuse to speak out against him when he does undermine things like the sanctity of elections, like the peaceful transition of power, like not denouncing white supremacy. You don't speak out against him.
I think I've been pretty clear today. A pretty clear message, what I believe. As governor of the state of Ohio, this will be a fair election. The votes will be counted. Nobody else will decide but the voters. However this election comes out, as well as all the other elections, that's who will win. Any idea that the legislature will do anything, it's not going to happen. We have run fair elections in Ohio for a long time. There's no reason to think that this election will not be a fair one. And I think it's important on both sides. Let's not presuppose we're going to have a problem when we have both parties who have a vested interest in a fair election. As John Husted pointed out, what we do in Ohio, and I suppose they do in most states, is down to the precinct level. We have both parties involved. It is a system. Sure, there could be a mistake. There can be mistakes made. We don't say it's perfect, but people should have confidence in Ohio that their vote is going to get counted, and they have myriad ways of voting. And so we have an obligation to make sure that happens. We have an obligation to make sure that people are right or left who believe in disturbance, don't believe in the rule of law, who believe that violence should take over, that is dealt with. And we fully intend to do that in the state of Ohio. Press conference after press conference, I get asked about different comments made by the president, somebody else. I'm not here to answer every single thing the president says. I think I've been very clear throughout my career and throughout my time as governor what I believe in and what we will do. It's not just what I believe in. It's not just what I say. It's what we do. And so, we'll continue to speak out against violence. We'll continue to speak out against anything that disrupts the fairness of an election. We'll continue to speak out against hatred and violence. And that's what my job is. My job is not every single day to critique the President of the United States, nor to critique Joe Biden. And, if there's another president in there in January, I'll have the same attitude. Look, if Joe Biden is president or Donald Trump is president, takes the oath of office, whichever one on January 20th, I am not going to spend my days, debating or critiquing what that president says. What I am going to do is do the best I can for the people of the state of Ohio.
And Governor, what I'm saying is, as governor of Ohio, you're prepared to stand against either President Trump or Joe Biden if they were to do something that goes against the Constitution. That's what you're telling the people of Ohio
absolutely.
right now.
Well, I thought, Eddie, I think that was a question. Absolutely. I think people should know me. I think they should know what, people can disagree about what we've done in the virus. They can disagree about all kinds of things. They can think my position on this is wrong, my position is that is wrong. But no governor of the state is going to stand up here and say that, or have any intention, I would hope, that we're not going to follow the Constitution. The will of the people will prevail in the state of Ohio. The electoral votes in Ohio will be cast for whoever gets the most votes in the state of Ohio. I will guarantee you that.
Thank you.
Next question is from Max Philby at the Columbus Dispatch.
Afternoon, Governor.
Hey, Max.
So experts are warning that child immunizations are way down this year because of COVID-19, and warning that could lead to some outbreaks of measles and whooping cough and other things. And so my question is today, does Ohio have the resources to track and contain those kinds of outbreaks on top of COVID-19?
Well, thank you for the question. We're very concerned about this. We're very concerned about this. There is this anti-vaccination movement that I think is very misguided. We also add on top of that that people, because of the COVID, have sometimes been reluctant to go to their doctors. So we are looking at advertising about this, messaging about this. I will continue to say that, go to your doctor, take your kids, get their shots. So this is a real issue. It's something we're very concerned about, and that we're going to continue to work on. And it's just very, very, very important that people do that.
Next question is from Jack Windsor at WMFD in Mansfield.
Hey, Jack.
Hi, Governor. This question is for you, and actually first for Dr. Abbey. And it's, how do you account for people who were infected well before July? Because you mentioned that immunity can last 3 months or be easily detected during 3 months. Pike County Department of Health says they had the virus there in November 2019, a time that would account for close indoor contact during Thanksgiving, Christmas, New Year's celebrations. And we were told it was more contagious early on. So there are at least three-month intervals since that time period during which people could have contracted the virus and the immunity could have gone from strong prevalence, easily detectable, like you said, to some sort of immunity that isn't detectable now. So how do you account for those people who were infected previously? And do those topics get covered in the report? And then, Governor, are you now saying that we are in for masking, distancing, and quarantining for years?
No, I'll go first. Look, I think the faster vaccine can get out, the better it is. We have a couple things going for us. I think that and this is the reason why people don't want to get it and should not want to get it. And that is doctors have already gotten a lot better at keeping people alive and bringing them back to good health. That will only continue. I think we can expect that to continue. The ability to deal with this once you have COVID will get better every week. And at the same time, the sooner we can get the vaccines out and the sooner people take them, again, been some concern about whether people will take the vaccines, but the sooner we can get to that point, I don't know what that point is, but that's what we have to do. And that's what we should do. But I can't put a date on it. Jack, there's no one that I don't think any specialist can put a date on when we will be able to achieve what we need to be able to achieve. So I'm going to let the doctor answer the other question on the study.
Yes, great. Thank you for the question. So what I was saying about that 3-month period is just something for everyone to keep in mind. If they get a positive antibody test, they're screened for COVID. For example, they give blood and the Ohio Red Cross tells them that they're antibody positive. That means that they most likely had infection sometime in the last 3 months. It doesn't mean that they had it exactly 3 months ago. It means that they had it sometime in the last 3 months. And because those are the same assays that we used for this study that was conducted in July, it can only give us a more confident answer related to the number of people that were exposed to coronavirus, or not exposed meaning they were at risk of disease, but who actually had infection in the 3-month period before that. How it relates to earlier in the spring, that this study I described today doesn't tell us about those numbers because the antibody assays don't capture infections that occurred in that time period. And I'll also say this is just one of the surprises about COVID-19. So folks will know that COVID-19 is caused by SARS-CoV-2. And at first, we were making a lot of inferences about things like antibody levels from our experience with SARS-CoV-1, the virus that caused the original SARS epidemic. And for that infection, people have antibodies that persist for many months and even years. And so the assumption was these antibody tests would give a longer picture, a longer timeline of how many people had been infected. And it's only been in the last few months that there's more data showing that, in fact, the time span is a bit shorter. To answer your specific question about cases, for example, in 2019, I'm not aware of any plausible data that shows that there was circulating virus in Ohio in 2019, and if there were cases in very early 2020, those only were, as folks probably know, only determined after the fact, because of course our first documented infections were on March 9th of this year.
Thank you.
Next question is from Tom Bosco at WSYX in Columbus.
Hi, Governor. I want to ask you about something I did a story on last week. When your public advisory map came out last week, Delaware County moved from level 2 to level 3, and then this week they're back now from level 3 to level 2. But last week when they moved to level 3, the Delaware General Health District came out on Facebook and said, hey, look, it's not that bad. Things are actually improving. Those numbers are 2 weeks old. The question is, what number, and this is a question I know that's been kind of addressed since March probably, is what number should people be looking at to base their daily activities on? State numbers, county numbers. I understand that the map is like a different set of numbers, and the county's got their daily case numbers, but and is there a fear that people will just look at the number and cherry pick the number they like when they want to decide how they're going to act in their everyday lives?
Well, excellent question. I'm not aware of what was going on with Delaware. I'll find that out, where there was a discrepancy of how we were looking at things. I just don't know what that was. But from the beginning of this pandemic, we've proceeded under the assumption that one of our jobs, or my jobs as governor, is to get as many facts out as we can. When you do that, certainly people can cherry pick, as you say, some of the numbers, and people can read into it what they want. I would simply say, try to look at all the things. If you can only look at two things, I would say look at the chart of 88 counties that we put out all the time, and that is not history. That's 2 weeks back. So it tells you what's going on now in your county. How many new cases have there been in your county? I would also look at the color code and see, again, that is 7 different factors, including number of cases, but it's seven different factors. I think if my county was over 100, in other words, it's what the experts say is high incidence, I would be concerned. But what people do, whether in a yellow county or an orange county or a red county, probably if you talk to health officials, the advice is going to be the same. Be careful. If you are at really high risk because of your age, be even more careful. Because you're diabetic, because you're obese, whatever that is, be really, really cautious. Everybody else, wear a mask when you go out. Do everything you can to keep social distancing. Don't be close to someone for a very long period of time, because you don't know who has it and who doesn't have it. So I think what people should take from all the information we're giving them, I don't know that what they really do every day is going to be dramatically different. I think if I was in a county, that's double, for example, high incidence, over 200, for example, it's an alert. You just have more problems, and your odds. This is all about what your odds are, because the problem is you don't know who has it and who doesn't have it generally, and many times they don't know. So now your question is, of all the people I see, how many of them are going to have the COVID? And we really don't know, but it's going to go up if these numbers are up in the community. But doing those basic things, takes all the guessing out of it. And it seems to me that's what our message, frankly, should be. Thank you. Today we have a video to close featuring 100 musicians from the Cleveland Orchestra and the Cleveland Orchestra Chorus. They recorded parts of the 4th movement of Beethoven's 9th Symphony, the Ode to Joy, in well-known locations in Cleveland and Northeast Ohio: Severance Hall, Public Square, Blossom Music Center, Progressive Field. This year is the 250th anniversary of Beethoven's birth, and I know that pre-COVID many performances of his works were planned. The Ode to Joy is set to the words of Schiller in German, that all people become brothers. Let's take a listen. Well, that was great. We will see you all on Tuesday. Have a good weekend. Thank you.
All right, everybody. Governor Mike DeWine wrapping up his Thursday coronavirus press briefing there. Talked a lot about things outside of coronavirus. He talked about the debate. He talked about the disorganization of it towards the beginning there. They also had a doctor come on and talk about different antibody testing. Let's take a look at the numbers and then, guys, with that. All right, one last look at the numbers here. 1,327 new cases reported within the past 24 hours. That is about 300 cases above the 21-day average, and it's also the most cases that we have seen in the past 21 days. 24-hour reported deaths, there have been 13. That is below the 21-day average of 22. Reported hospitalizations are above the 21-day average. They are at 90 reported over the past 24 hours. And the latest ICU admissions over the past 24 hours, there have been 9. The 21-day average is 11. We will see you guys coming up here in about a half hour on First at 4, and the governor will be back next Tuesday for another briefing. Thank you guys so much for watching. More information on NBC4i.com. Bye.